Well, good morning, and thanks so much for joining us today. I am Sean Egan, the Deputy Director for Labor in Michigan's Department of Labor and Economic Opportunity. This is the first in what we hope to be a series of webinars where we focus on the concept of workplace mental health and try to provide interesting topics, speakers, and information that you can use and bring back to workplaces across the state of Michigan to help us address this issue. Uh, Please note there is a live Q&A feature throughout the presentation. Add questions at any time throughout the presentation. We will get to as many as we can at the end of our time today. We will have this video recorded and posted afterward on the Resource Hub that hopefully you all have seen now. We're going to continue to develop that tool and add things to it as we can move forward in these processes. And first and foremost, I just want to talk about a year ago, I had the privilege of leading a work group that included employers, employees, professionals, and others that really got into the concept of workplace mental health. And we really focused on data, where people currently are, what we're seeing in workplaces, what the pandemic has done to people. We looked at how our stress response works for all of us as human beings and what the impacts of chronic stress, trauma, adverse childhood experiences, resiliency, and the bottom line impact to businesses across the country, but certainly in the state of Michigan, and how much that's impacting the health and well-being of our communities and our workplaces. When we thought about the concept of why the workplace, well, first and foremost, that's where people are. We spend a lot of our time, typically eight hours or more a day in the workplace. So that's where we are. It's a great intervention point, but also a point of potential stress that we want to try to identify. And 65% of workers surveyed identified work as the number one stress in their life. So if you look back at our report and that data, you'll see why we're going to talk about stress a lot and chronic stress and why that's so important. And interestingly, if you haven't researched this, if you do, you'll find over and over again that there is a $4 return on investment for every $1 an employer invests into workplace mental health. So we came up with a list of recommendations. Among those was to develop the Resource Hub that we launched last week and hopefully you find useful. We're going to kick off this monthly webinar series to try to bring the right information and topics and resources to our communities to make sure that you can find ways to start integrating mental health into your workplace. One of the recommendations, and we hope to do soon, is to break into industry sectors so that we can highlight specific issues that might be more common or relevant to a particular industry. Think medical, manufacturing, service workers, you name it. And we also have a strong partnership with DHHS. You'll see a short video at the end of our time today from Dr. Deborah Pinals, one of the directors in DHHS that's been a partner with me all the way through. As we look at workplaces, certainly from a Department of Labor perspective, thinking about the organizational pieces, but DHHS, certainly the resource piece when it comes to our communities, providers, and creating that individual support that people need to help themselves overcome some of these issues. So keep in mind, you can add those questions at any time. And to run through just a couple of data points I wanted to pull. When we did the data for the report, we were looking at 2021. So I went back to one of our great resources, which is Mental Health America. They've done a workplace specific survey for a lot of years. And I'm only going to get you a couple of slides here just to kind of give you some of the data on what we're seeing and where people are going. We found a really heightened sense of anxiety and depression out there, either symptoms or actual diagnoses. And from their 2022 update, Mind the Workplace report, the annual survey of workplaces is continuing to show challenges in our workplaces. So this is just people that find it difficult to concentrate at work, continuing to see increases. Now, when I think about workplace safety, that difficulty concentrating raises red flags for me, because if you're disengaged from your work, the chances of you getting injured while working increase. But this is also an indicator that people are stressed, that something's going on, could certainly be pandemic related, but they're having challenges concentrating at work. And they're also saying in a wide margin that the stress from work itself is causing other mental health concerns. And when you go back to our report, if you haven't reviewed it, we talk about how chronic stress can push people into chronic health conditions, but also anxiety and depression. So we want to be mindful of how people are feeling in the workplace and things that we need to do to try to mitigate some of this, because it's creating potential workplace hazards for sure, just from a safety and health perspective, but also creating challenges for those employees to engage in their workplace and make sure they can continue to be productive. But this was interesting in this report. The Mental Health America looked at what they determined unhealthy to healthy workplaces on a spectrum. And they asked the same questions of all of these workplaces, and you find a separation that occurs for those moderately healthy and healthy workplaces. Now, when I use those terms, these are their terms, and they have 5 bullet points that really focus around the concept of quality jobs, where employees have more opportunity to engage, employers investing in workplace mental health. They're creating systems and processes that support that. So you see a divergence point where an employee identifies their workplace as moderately healthy or healthy, that the likelihood of mental stress impacting other mental health concerns decreases significantly. So we see that in a healthy workplace, a majority of workers are not having stress from work leading to those other mental health concerns. So when we talk about creating that mental health friendly workplace, this is kind of some of the information that we're trying to get across, is that these investments pay big dividends for people in our communities. And the great news, and more news for the bottom line, is when we're talking about labor shortages, the absolute best way to deal with that is to make sure you keep the employees you have and you keep them healthy and safe. And what we find is 69% of the employees who believe that their employer supports their mental health are less likely to search for a new job. Now, I know we're all seeing the news, and we're seeing all these reports about 1 in 5, 2 in 5, 3 in 5 looking for another job. In workplaces focused on workplace mental health, we're not seeing that. And it's a great outcome that we want to make sure that we share across employers across the state of Michigan to not only strengthen their workplace, but strengthen their communities. So that's enough data for me at this point. We're going to have a lot of this information continuing to develop on our resource hub. But I want to thank and welcome our very special guest today, Rich Mattingly, the founder and president of the Love You Project, which is a national organization. And he's going to share with us what they've been doing and focus on workplace mental health. Thank you so much, Rich.
Well, thank you, Sean. And let me begin by thanking you and your team for elevating this discussion, and for all the people that are participating today who care about mental health in the workplace. I thought it would be helpful if I went back and told a little bit about my story as to why I'm so interested in this space and so passionate about making a difference. I spent nearly 38 years building and running the Cystic Fibrosis Foundation on a national level. Cystic fibrosis is a genetic disease, and when I began many years ago, life expectancy was quite young for those. It was a terminal illness. There wasn't much hope. We really did remarkable work. The team at the foundation built tremendous science. The passion of the parents and the volunteers was extraordinary in helping us develop really a game plan, a business plan that transformed not only the fight against cystic fibrosis, but in many ways, it transformed modern charity in America. We ultimately started developing drugs, and that was unheard of, even unthinkable at the time, that a nonprofit organization would become interested in working alongside of a for-profit company. But the technology had advanced and the opportunities were present, and no one was going to play and work on cystic fibrosis if we didn't invite them and entice them and invest in them. So to make a long story short, the Wall Street Journal, I believe, coined us the inventors of venture philanthropy. And we began to take a very aggressive position in advancing science and technologies that could advance the therapeutic development, coming up with either a corrector or some sort of a way to cure cystic fibrosis. Thankfully, we made great progress, and for about 90% of all patients in the country today, they can take an oral medication, and it's making a phenomenal difference. It's a great story. Equally as important, perhaps, is the fact that the science is continuing to evolve so that the future generations of those will do well. We also did well financially in making sure that the foundation got something back monetarily as a return for that investment. And that story is a beautiful story that's actually even taught at Harvard in the business school. but it has a chapter to it that's very, very troubling. And for me personally, is a tragedy in ways that goes beyond really description. But I'll try my best to share it with you today. You see, there was someone that was stealing at the Cystic Fibrosis Foundation, and my team came to me one day and they said, Rich, we've got evidence. We'd like to show you what's going on. And I said, that's unacceptable. You don't steal from anybody. You certainly don't steal from a charity. Go get him and confront him. And that individual, when that happened, he went in pursuit of us, me, and ultimately went to my home, and he killed my wife. He shot her, and he turned around and he set our home on fire. That day, there's no way to describe what transpired that day, other than I lost the most important person in my world, my love, my wife of 35 years, and we'd been together 45, a wonderful person who had extraordinary talent. She was as beautiful on the inside as she was on the outside, and she was a beautiful lady. But she had done an awful lot to help advance a number of causes. She cared deeply about issues, particularly behavioral modification issues for children and helping people that were in trouble. She worked on a great program with incarcerated women, trying to reenter society and the like. So on that very day, I lost not only the love of my life and my wife and the mother of my child, but I lost my home. I never went home again. And I decided to retire from work. And I said it at the service for my wife that we will honor her and her goodness in a way that will be memorable for a long time. I didn't know exactly what we were going to do that day within a week of her passing, but I knew that we would call it the Love You Project. And the Love You Project is named because she would write her text, LUVU, and she'd send it to me when she'd send something. Or she'd send that to my daughter or to a dear friend. She'd always put love you at the end of it. So I said to my daughter, it's only natural that we're going to build the Love You Project and do good. So the question is, when you want to do good, where do you play? Where do you concentrate your efforts? And there were a few things that we wanted to continue doing that she did that supported, again, behavioral modification for young people and helping kids that are troubled. And helping incarcerated women in particular. So that became what we call Promises Kept. But I began to engage in dialogue, particularly with people that were 25, 30 years old. And this had really begun back in my work at the Cystic Fibrosis Foundation, because patients that we were working to help their lung capacity and their breathing were starting to say to me, Rich, a lot of great work has happened for my lungs, and we're seeing great progress, but you need to think about my head too. You need to pay attention to the fact that as someone living with a chronic disease, we need help to think through problems, to get jobs, to stay at work, and to keep social engagements and to have partnerships and the like. So when these other young people started saying to me, Rich, I can't imagine you spending the rest of your life in anything but mental health after what happened to your wife, Carolyn, and the fact that it is so prevalent. We are all touched by mental health. It impacts us daily. It would seem only logical that you would try to take your skill set for the past 4 decades and apply it in that space. And they were quite convincing. And they said very bluntly to me, someone of your age is very likely to push off mental health, to not embrace it. Our age want to embrace it. We want to break down the walls, the stigma that's associated with mental health. We want to start talking about it. We want our employers to start talking about it. And we want to collectively make a difference. So it's a better place to work. And when we go home at night, we feel better. It's a big cycle, you know what? And as Sean said, the greatest amount of time we spend in the majority of our lives is in our workplace. But when we go home at night, we make for better family life, and we make for better parents and everything else if we're able to address these concerns that we have. So out of that, I decided that if I was going to focus on mental health, I needed to travel and to go to school and to learn. And through the work that I had done, I had the privilege of knowing a lot of great medical minds in this country, certainly academically, a lot in government, and a number in industry. So I traveled the country and I spent time with these great minds, and I asked them, what would you do if you were in my shoes? And what would you focus on if you were building an organization? And time and time again, I started running into conversations that centered around the workplace. I would say that there are two things that came up that were really material, that were relative to the workplace, but that we decided to also focus on. One was the fact that in the media, there wasn't enough being talked about. There's a great deal of attention in the media about the crimes, things like happened in my life, but there's not a lot of attention about workplace stress or we tend to sometimes say mental health, and we identify it with a tragedy. I want to be very clear that mental health is not all about tragedy at all. Everybody has depression, and everybody deals with trauma and issues in some way or another. And if you don't, someone you care about does. So as it turns out, and you can look at the data, and 1 in 5 people have a mental health diagnosis. Some data would say 1 in 4. You look at the data that Sean was talking about and the relative impact on the workplace. But in reality, no one is not affected by mental health. And when you look at behavioral disorders and mental health, it's the most expensive impact on the workplace in America. It's a $200+ billion impact on industry every year. And frankly, that's data that's almost a decade old. It's considerably higher today. Depression is the leading cause of disability for those people between 15 and 44. And depression is a major factor in the workplace. Suicide, the loss of lives as a result of suicide, is escalating at a rapid pace. And it's happening with young people and old people alike, and everybody in the middle. And there's words that are absenteeism when we're in the workplace that we talk about all the time, but there's also this word preteeism. The people that come to work, but their productivity falls because they're focused in a different area, or lack of focus. So there's so many things that the workplace just sort of was screaming. And the scientists were saying to me, hey, Rich, it's a no-brainer for you. Focus yourself on the workplace. And as I began to embrace that and go out, people would say, I get it, Rich, I understand why the Love You Project cares about the workplace because of what happened to you. And I would say, no. The reason that the Love You Project cares about the workplace is because the scientists and the great minds in this country identified and made a case that the greatest impact we could have on the American public, and certainly on the workforce, is to do a better job in embracing the way we address mental health and behavioral concerns in our country. It's almost like a black hole. I can't say there isn't any data that really supports it, as Sean has cited some, but the amount of data is quite small. And frankly, best practices are very, very thin. If we have a cardiac issue in this country and you present at the emergency room, there's best practices for how to handle that. If you have a broken arm and you present to the doctor, there's best practices. But often in a mental health environment, if you go into the hospital or the emergency room or for private care, the way in which it's addressed is very uncertain or very irregular. And we've got to identify evidentiary-based practices that make the field of mental health and the treatment. And frankly, we've got to attract a lot more people to be in this space to help us, because oftentimes employers are very willing to embrace different pathways for mental health, but they have trouble in finding people that will help them. But along the path, I had 2 curveballs that were thrown at me. Number one was back to this media thing, that the media so often wanted to only talk about the bad tragedies, and they didn't want to talk, or they didn't want to report about the impact of mental health on everyday society. So I decided to build an award, because if you recognize people and you elevate the attention, you can do some very good work. So we built an award in journalism called the Carolyn Award, the Mattingly Award, for mental health reporting. And there was some reluctance to embrace that in the beginning. And it was really, there were 2 former heads of the National Institute of Mental Health that inspired me to do this. They didn't know it, but they both said the same thing in 2 different meetings. And they said, boy, if we could just get some more attention. So anyway, we built a journalism award, and I'm proud to say, in partnership with the National Press Foundation, and the number of submissions, and I'm talking about from major publications, the New York Times, the Wall Street Journal, ABC, the broadcast networks and the like, were phenomenal in the first year. And the first body of work, and by the way, we offer a $10,000 cash prize for that journalism award because it's the same as a Pulitzer Prize, and I wanted it to be taken seriously. And each of the years that the Journalism Award has been presented, the body of work has been impactful and made a difference. The first year was an award given to a collaboration between two competing newspapers in Florida, where they addressed the concerns and documented the evidentiary-based results of major millions of dollars of cuts in healthcare services. As a result of their work, some of that money, a good bit, was restored. And I might add that one of the reporters came to us and said, I'm so delighted that you've offered the opportunity to embrace reporting in this arena because I have dealt with mental health. And that reminds me of what we deal with every day, the stigma. We've got to begin open dialogue and conversation. The other thing that the curveball that I learned was that if we're going to make a difference in this space, we're going to have to do it through embracing the young people who want to move the needle, so to speak. So we have a component called You Lead, and that's a young professional group that's 25 to 45 that are in the workplace, that are helping carry the message of embracing mental health and transition. And I'll tell you, they're doing some remarkable things. And their motto is out of love, you lead. And these are people that are growing up and in a few years are going to be, in some cases already, are making the decisions in the workplace. And if not making the decisions, are presenting the data and the evidence to help the leaders make the right decisions. But no matter where you go, you have to have, if you're trying to make a difference in workplace mental health or in any kind of scientific initiative, you really have to focus on a signature program. And I decided after traveling throughout the land that our signature program would be with Johns Hopkins. Most of you know Johns Hopkins. It's arguably the most notable and highly recognized and respected medical institution in the country. There are some people that would disagree with that, but it's a winner. And we've certainly got used to looking at the data that comes out of Hopkins daily about COVID in the last few years and the like. Let me tell you why Johns Hopkins was so important to me. It has a policy and an initiative in public health that's remarkable. It's the oldest school of public health in the world. It's the only school of public health in America that has a department of mental health. And I think if you're going to focus on mental health in the workplace, you have to have at least the best knowledge and the best package to work from. So we decided back in 2018 to assemble hundreds of the best minds in the country and to sit down and to discuss mental health in the workplace. So we held a public summit, and then we held, we seated a board of advisors, and we locked the door for 2 days, and we talked about the details and what is missing, what's needed. And we came up with 9 fundamental facts, and I won't go through all of them, but we clearly need to create a scorecard for how to measure. We clearly need to recognize those that are doing good, so that others can raise up, establishing the bar, so to speak. And I'll come back in a second. We talked about the economics. We talked about data. And there is within the health sector, and certainly within the mental health sector, there are big gaps where we need more data. We need to be able to collect data and move on. We also need to establish a home base for a lot of this conversation. And we decided to establish a center at Johns Hopkins, which is the Love You Center for Workplace Mental Health. Well, you'd say, well, why? Because we've got to establish a home where government and industry and private sector and academia and all can work together, and where they can come together and look at the same information, as opposed to have one meeting looking at one bucket and then another meeting looking at another. So I'm very proud to say that we have established that and are fostering that program as we speak. A lot is coming out of it. I'm happy to get into greater detail, but because of time, let me focus on one that I think is so relevant to what we're talking about today. We decided, one of the 9 principles that we decided was to recognize those that are doing a good job with mental health in the workplace. After all, in this great country of ours, we recognize great athletic achievements as the most valuable or the most recognizable of athlete. We have the Academy Awards, and we say this is the best picture you could ever see, or the best director. We recognize so many things, but we were not recognizing those who were doing a really good job. And if you start by taking a look at American industry and you say, who out there is making a difference? And how can we quantify those differences? And by the way, the Love U Project mission is very specific to that. It's to take an unacceptable tragedy and turn it into a quantifiable agenda and responsible actions. Talk is cheap. Results are what we're after. So how do you take the results of a great company? And by the way, as we started studying, and there were independent studies that were presented to us, and you look at the companies that were doing the best job in addressing mental health and well-being among their entire spectrum of employees. I'm talking from top down, bottom up. Those companies have better dividends, better gross, better EBITDA data. Across the board, they perform better, and they serve their stockholders or their constituents better religiously. So we started looking at those, and we said, boy, we need to identify more. Let's establish an award. So born out of that conversation and a year's worth of science and research was the new Carolyn Mattingly Award for Workplace Mental Health. We told the public and went public with this about this time last year, early in 2022. It was modeled in some ways after the Coop Award, which is the only award of similar style in America, but we looked at lots of different things. And we began by saying, hey, to be able to build an award that focuses on workplace mental health, you've got to be able to have a good workplace that cares about physical health and the well-being of your people. You need a good foundation to work with. And then on top of that, what are you doing that's providing services, pathways for people so that they're more comfortable at work and they're more comfortable in their everyday lives? So the criteria that was established is quite rigorous. It's remarkable when we were finished with it, what a company would end up needing to do to demonstrate that they're committed to this. And we were expecting to see a handful of submissions. It came in a lot more than that. I was taken aback by the number of companies that were very interested in coming forward and saying, hey, we want to show you what we're doing. And when it was all said and done, our panel of judges, and by the way, we have a separate advisory board for that as well. Our chairman is the former chief medical officer at Prudential Financial Group, a remarkable guy by the name of Andy Crichton, an MD and a great visionary. And obviously a great team at Hopkins, and a lot of other very successful and very balanced people from industry and experts in this field. So when we were all said and done at the end of the cycle of looking at applicants, and by the way, not only do they have to demonstrate that they're performing at a very high level, they go through due diligence to make sure that their employees, and at least in a public sense, that the employees feel that they're doing a very good job. We were proud to award the first 3 recipients this past year, and that was to Aiken Gump, one of the nation's leading law firms that had a remarkable history and great program, to the Nashville Public Schools, another great network and a very effective employee well-being and mental health initiative, and to the University of Virginia. And they too were, and the irony is when we were presenting the award, the University of Virginia was going through the trauma that we all heard about, one of these tragedies just this past year. But their program, and I saw it in action, but their programs were really extraordinary. Each of the people that submitted, they got an extraordinarily extensive review, whether they won or whether they didn't, to say, here's areas that you're doing really well in, here's areas that you could help. So when it was all said and done, we're very proud to say that we're launching the new initiative this year. It will go, we'll open applications in a couple of weeks and close submissions at the end of May and have another set of winners this year. So the Love You Project spends its time now pretty much exclusively on mental health in the workplace, with the sole purpose of creating a quantifiable agenda and responsible actions that will make change.
Thanks so much for that, Rich. I think we had a couple of questions that came in. It looked to me like Erica was able to manage those, so those have been handled. I think one thing you said in particular, too, that we saw in our work group that we're trying to work through, and the point of the resource hub is that there really isn't like a if you do X, then Y type situation here, and there's not a long list of best practices, but there are tools. So we're trying to make sure that we identify those well and provide those for folks. And, you know, as we're thinking about this, right, this is not necessarily like, hey, if I just adopt this one thing, everything is fine. It's going to be a mind shift, and we're going to have to get it set in on the reality that this is going to be a continual progress of growth, enlightenment, and education. So we're excited about where we are. Thank you so much for joining us today. We're going to close out today with just a short video from our partner, Dr. Deborah Penals with Michigan DHHS. And thank you all so much for joining.
Even though we have collectively grown more accustomed to managing COVID-19 prevention and treatment, people are still dealing with emotions related to the many ways the pandemic changed their lives. Research shows it can take years for people to process grief, loss, and other reactions to large-scale disasters like we experienced with COVID-19. With depression and anxiety becoming leading causes of people being out of work, and workforce shortages creating strains on people trying to cover more responsibilities, it is critical for us to prioritize mental wellness in the workplace. This is why Governor Whitmer promoted a collaboration between the Department of Labor and Economic Opportunity and the Department of Health and Human Services to examine workplace mental health. Businesses and other organizations are most productive when staff are healthy and safe, and that applies to paying attention to physical and mental health. Employees should not hesitate to use employee assistance programs where available. By the same token, managers must recognize staff's need for time to engage in self-care and other mental wellness activities so they can bring their best selves to work. Open discussion about mental well-being by the employee and employer can allow for important dialogue. When employees feel supported by management, they become more motivated and productive. Remember that there are lots of resources out there to support employees' mental health and the mental health of their family members. Such resources include the Stay Well program. Visit michigan.gov/staywell for access to free educational workshops, online discussion groups, videos, hotlines, brochures, and other resources to promote mental wellness. And thank you for listening.